You're not audible. Okay, greetings from Greece to all. I would like to welcome you to GYMHA Mind Matters talk show. It's one of the episode of the longer series of mental health issues that the GYMHA organizes. And I'm very happy, very privileged and honored to be a part of this great talk show. Uh, Today, we have an interesting topic with us, and we hope that our guests will overcome the technical issues very soon. I'm Rania Lampou. I'm Director of Training and GYMHA board member. I'm actually educator. I'm global educator, STEM instructor. I'm working at the Greek Ministry of Education at the Greek Astronomy Space Company. And also, I'm a youth mentor. So today we will start from difficult emotions. Why? Because emotions are among the trickiest things to deal with. They affect every aspect of our lives and largely define their quality. Without understanding how emotions work, we will struggle with living our ideal life and fulfilling our potential. What we should do when we experience difficult emotions? Um, I will share my thoughts, and after I will invite our guests to present their views. So first, I think we should start to explore and understand why we might feel such intense or difficult emotions. Where might they come from? Why do we perhaps seem to struggle more with emotions than our friends or family? Because you know that many young people who struggle to cope with overwhelming emotions, this can lead sometimes to some risky behaviors. Psychologists, teachers, and doctors sometimes call this emotional dysregulation. And we all know also that intense emotions can be associated with lots of different problems like self-harm or angry outbursts or traumatic stress and relationship issues, problems. Especially if we have neurodevelopmental differences like difficulties social communication, impulse control, attention, concentration, then this can make experiencing managing emotions trickier. And especially intense emotions will be hard to handle. And many people who struggle with their emotions without letting anyone know, that is very common, because we're not all lucky enough to have been taught about our emotions and how to handle them when we were growing up. And even for those of us who did learn about this, life can usually throw tough things, so makes this overwhelming to cope. And to select which regulating strategy we should follow. And as we get older, relationships become also more complicated. So we need to understand our emotions to stay healthy and develop our ways to feel okay. When people struggle with these emotions, this means that they haven't found ways to soothe themselves when they get overwhelmed or life gets stressful. So if you can't self-soothe, you have to find other ways to cope with intense emotions. And this can be, usually the easy way is to injure yourself, to use substances like drugs or alcohol, or be very controlling of your environment. All of these, of course, are unhealthy strategies. Before sharing my views, also, may I invite Ms. Mahmooda? You're not audible. Okay. Is Dr. Solomon is available to share his views? What are the strategies that we can use in order to cope with difficult or intense emotions? Hello, welcome.
Greetings and thank you so much for the platform and point of correction. It's not doctor, it's Solomon, much more of an advocate. And then, yeah, exactly. All right. When talking about emotion, I think this is quite very um, something that needs to be talked of because of uh, we have it, we deal with it every day, but we don't exactly know why are we facing it. Uh, uh, Looking at emotion, looking at as stress as is a way in which the body kind of like respond to any kind of demand. It does not matter what kind of demand the body might be responding to. Sometimes it could be the body might respond to positive demands, and also certain time it respond in a negative format. So it depending on how the body is reacting to any demand that it needs. Some of the emotions actually are positive. They lead us to a positive doing. Likely when you start feeling in a way that stress you to get up every day to go to work. You can also have in a way that emotion help you to prevent yourself in terms of accident, in terms of you see something that is tragic, and then your body mechanism will respond in a very positive way that helps you to control the action. But it's also to a certain stage where it can be very overwhelming, where it can be very negative and affects your thoughts and everything around you, socially, economically, everything that has to deal with you as a person. So it's important, as you said, we're talking about mental health, we are talking about emotions, we are talking about it's important for people to be aware on how do we deal with our psychological emotions. I call it also emotional intelligence, the self-awareness of individuals in order to respond to to different environmental factors that might influence our behavior. So it's important, as you said, to recognize, and I believe probably as the conversation go deeper inside, more elaboration could be of spoken.
Thank you very much. Emotional intelligence is a very important topic, especially if we talk not in education, but also in business. Also, it's nowadays a concept which is very well used. You can be successful, don't have emotional intelligence in all fields of life, and you know how to regulate your feelings. And I want to add something here. What we call co-regulation is important because many times, if we have experienced difficult things but still we are good at coping with these feelings, then this is probably because we had adults, maybe older brothers or sisters around us who were able to read us and tune into our emotions when we were little, and then helped us deal with them. It's what we call co-regulation. Adults who can tune in and read, for instance, a child can help them recognize their emotions, give their emotions names, and then calm their emotions down according to what they need to feel okay in their bodies. And if we talk about adolescence, which is a very critical developmental period, this is very risky because difficult, intense emotions this way can lead to unhealthy strategies I mentioned before, risk taking or feeling lost or struggling to find your identity. This could lead also to trauma also. And trauma has significant impact on our brain. So you said about some tips, you suggested some tips that I could add also that after every storm comes a rainbow, and if we talk about difficult emotions, some tips that would be sometimes we need to take a step back and think about what is really important to us. The problem that we think that we experience becomes very small this way. So we need to put the problem in perspective because nothing is worth sacrificing our happiness. Nothing. It is impossible to control outside events, of course, that cause disturbance, but it is completely in our control to handle it. And we can also put a time limit on it. It means that we can tell ourselves that we're going to think or talk about this problem for only 1 hour a day until it's resolved or come to acceptance. And once the hour is over, you can choose an activity, for instance, that is the opposite of the emotion that we are feeling to change our mood. So these are some important tips. And of course, it's significant to engage ourselves in an act of self-love. Self-love that could be listening to relaxing music, that to go to yoga, to practice meditation, to go out with good friends. And I forgot to mention, when we talk about difficult emotions, you need to start from observing the emotion because you are not the emotion of your thoughts. You can take a step back, as I said before, and witness what your thoughts and emotions do when there is disturbance. What's the thoughts or your self-talk? I mean, do not avoid, because avoidance makes the emotion and the thoughts louder. So allow yourself to have the emotion. Don't fight it. Don't escalate it by falling down the rabbit hole, as we say, and attaching to the thoughts. And don't delay because many times if we make a decision in the emotion, it will make it worse. Because they say that any negative urge or craving lasts for about 20 or 30 minutes. So it will help us to delay a reaction for 20 or 40 minutes with a distraction. We can go to work or help someone else or go for a walk, take a break. And once the time is up, then we can make a pros and cons list to whether our reaction is worth doing. So the time also is important. Of course, let the negative energy go and be aware, as you said, of your physical, emotional vulnerabilities and your weaknesses and strengths. So thank you very much. And now we can move on with our next question, how we can deal with what we call depression. We have our second guest, Mr. Merit Laval. He's available to share his views. Mr. Merit, can you hear us? Okay, we're not able to hear you. If you can correct the sound. Okay, until Mr. Merit corrects technical issue, Mr. Solomon, can you reply to this? Can
Yeah.
you give us tips about depression? It's something which is very common nowadays. Yes.
Yeah, definitely. Depression is interlinked with emotion. So we have to understand that there are different levels. It's through stressors that could lead to major stress of individual life, and then it can generate to depression. And basically, there is a lot of misinterpretation about depression and the confusion because sometimes we interpret depression as stress, and then which is a different level when you are having depressive episode and then facing depression in real. because somebody facing depression, they are actually will may get to show certain signs and symptoms that will makes you identify that you are suffering from depression or any other thing. So it is important that the person may have some recurrent thoughts about their feelings or whatever they might be going through their heads or whatever. This recurring thought might be happening from death of a person or recurrent thought about suicide. They might think about killing themselves, losing of one's life. So this might be very often reoccurring. They may also faces the possibility of changes in appetite. They may change appetite in, in, in different varieties when it comes to food, how they react to people. They may also change sleeping pattern. These are some things that a persons can observe when they are facing depression as signs and symptoms. So the person might either feel quite agitated or also having certain kind of retardations in toward things. So this could be another sign also to be observed. Reduce in energy and also fatigue. This always can occur with people with depression. So difficult in concentration. They may also have feeling worthless or excessive inappropriate or guilt about common things. And the other one is hopelessness, feeling hopeless in anything. So when somebody is facing depression, it is important that one of these signs or symptoms does not justify that you have depression. Because we need to realize that the moment when one is having some kind of mood swing changes and then how they go back to it, and this is not exactly into depression. But when you are facing certain kind of uh, thoughts in your head in an observation for more than 2 weeks, and then you realize that some of these symptoms that I mentioned, at least you are having 2 to 3, going to 5 of the symptoms, it is important you seek for professional help. Then this thing is really needed. Then you need professional help. You may need a psychology, a psychiatric, or a caregiver out there that may lead you for treatment. So it is important that we know that depression could be called as the silence killer because compared to depression and other kind of diseases, we don't many times that we can easily fix things when we see with our negative eyes, or we can just get up. We have physical injuries, we can get up and give complaints. But when it comes to depression, it is hard because of also it's highly misunderstood by society in connection with the stigma, behavioral, uh, um, let me say, behavioral changes of an individual. Others might term it as rudeness or misbehavior. So it is very, especially when they start isolation, being on a side corner, and then withdrawal from friends, withdrawal from activities. These things sometimes is hard to be recognized by certain friends that are not recognizing it, but it's the main fact within community, within society. Majority of us have it very hard to recognize people going through depression. But it is highly important that when somebody is feeling that they are hopeless in the things that they are doing, they have certain traumatic event experiences, and then they don't want to be engaged anymore with anyone. Let us speak to them in a more polite manner that could be requesting them in case that they will need support, you are available to talk to, because sometimes only talking can help them free their minds if it is a moderate if they are facing certain moderate level of depression or any other thing. So it is important that we keep talking. And the more you talk about the emotion, the more you also feel peace. But if you don't talk about what you're feeling, what you've been going through, it's like, pouring a lot of water inside a container without downsizing something. So at the end of the day, it will overpour on the floor. So that could be the reaction there because you have so much in you going on that you not sharing, you not talking to anyone. You know, and it's important to know that information also needs to be balanced. You need to know how much is not too much, because it's good to get so much information, but how much is not too much for you? How much can you contain with these things? And how far can you go with it? So it's important to balance how our limit. Knowing our limit help us also to be more focused on a much more better uh, well-being state and on a sound more mental health. So it is good that the encouraging message so out there that depression is absolutely a very serious killer outside there, and it is definitely real. We all know, even the WHO has actually talked about their focus in 2030, that believing that depression could be the leading NCD, and this is through non-communicable diseases. And this is very alarming. And developing countries, not forgetting a lot of the social factors, poverty, and all other things could be triggering factors of depression. People in work class level not having things that they wish to have they wish to have, like their basic needs, can easily be agitating. So I think definitely depression is highly relevant and is a topic to discussion, and it is good for every human being to pay attention about it. Your friend, your colleague, your relative might be on the corner with certain pain that they are not sharing. So it is important you reach out to them when they are not reaching out. Find out what is going on. Let's give a helping hand, because it might lead of saving a life.
Yes, so definitely wonderful, great suggestions you gave us. And as you said, it's alarming. Depression, it's a worldwide epidemic nowadays that empties lives of many, can joy, it can even kill. And many people without depression, severe depression enough to qualify for diagnosis, still have depressive symptoms. In fact, over a 6-month period, one out of 5 adults and half of children and adolescents report some symptoms of depression. And although depression is not very common with young children, it becomes quite problematic during adolescence, and its prevalence appears to be rising. Uh, I want to emphasize, you suggested very important um, ways to deal with depression. And I want to emphasize what in cognitive therapy call automatic thought distortions. I can give you some examples. You say, I think I'm a loser. This is what in cognitive therapy we call mind reading. You assume that you know what people think about you without having sufficient evidence of your thoughts. You say, I will fail the exams, I won't get this job. You predict the future negatively. Or you say you try to catastrophize, or you practice negative filtering. You say, look at all these people who don't like me. Or you overgeneralize. This is a very important, very common in depression. You try to blame, you focus on another person as the source of your negative feelings, so refuse to take responsibility for changing yourself. Or when you're doing unfair comparisons, you keep asking questions about what if something happens, and you refuse to be satisfied with any of the answers. So this the automatic thought distortions need, of course, to be processed and dealt with. And why are we more depressed than ever? You know, psychologists have found that increases in depression during the last 50 years uh, correspond to have to do with a rise in individualism and narcissism, actually a loss of social connectedness. In the 19th century, for example, almost no one lived alone. Today, about 60% of households are comprised of a single person. So more or less, we are lonely, we're stuck watching television, and we're not socialized enough. So the good news is that for effective treatment, as you said, we can overcome depression, and we have a good chance of preventing its recurrence. There are self-help techniques that may able us to help reverse negative thinking. Three techniques that I want to mention, apart from what you said, is what we call cognitive behavioral therapy. Because
Okay.
this kind of therapy helps us change the way we think, so our cognition, and what we do, our behavior. Once we change the way we think, then we will change the way we feel, and this way we can break the cycle of self-perpetuated pain. And of course, depending on how severe a depression is, it may be best for us to have some outside help, especially if this is chronic or long-lasting debilitating depression can take an enormous toll on the quality of life. So this needs the help of an expert. Another issue is to cope with overgeneralized memory. People who are prone to depression, often remember events in vague and overly general terms. So rather than recalling specific details of an event or a period of time, they may say it was so depressing and difficult, things weren't going well. They don't focus on specific detailed memory. So this is a mistake, of course, which is related to depression. Another technique that we can use is mindfulness, because mindfulness is simply a way of experiencing the world, including
Yeah.
your inner world, in which we are fully aware in the present moment of what is happening. It's important because mindfulness lets us move from doing mode into being mode, experiencing, noticing, standing back, observing, watching, and then letting go. And research also shows that mindfulness training can help us recovering from depression and prevent a future episode. So incorporate meditation, it could be yoga, it could be deep breathing, assess the parts instead of generalizing the whole, that I mentioned before. Try to reward our efforts. Create a nice routine, listen to music, go spend time in nature, we walk, go spend time with our beloved friends. Try to express our feelings and try new habits. That could be volunteering. Volunteerism is something which actually fulfills. Practice gratitude. Of course, a healthy diet you mentioned, sleep patterns that you mentioned, limiting alcohol or drug abuse, and try to follow healthy hygiene. So all these things are important, and now we have with us another guest from India, Mr. Mohammad Zubair. We would like to welcome you.
Thank you, Miss Rania. Thank you. How are you? It's my
We
pleasure
are
to be
great
here.
here. We have a very nice discussion.
Thank you.
We have already suggested some tips and strategies about how to overcome difficult or intense emotions and how to cope with depression. Maybe you can share with us your
Yeah,
thoughts
sure,
about
sure.
what we can do when we have to cope with depression. First, you can
Okay.
introduce yourself, and
Yeah,
then
sure. First of all, I would like to express my gratitude to the organizers. I'm very happy to see all of you here. Uh, I am Mohammad Zubair, Assistant Professor of Special Education Learning Disabilities from India. I am working in the Central University, Central Government University here in New Delhi, India. I am working in the Teacher Training Department where I teach bachelor's and master degree students, those who will become teacher in future. So, we are working in the field of inclusive education, special education research, education psychology. So this topic is very crucial nowadays, because as we all know, depression is a complex mental health condition that can affect individuals in various ways. Lots of symptoms. Yeah, I was listening both of you because so emotional symptoms or the cognitive symptoms or the physical symptoms and the behavioral symptoms or the psychological aspects. So So lots of treatments are available, lots of strategies we can use to deal with them. So what are the some common tips for dealing with the emotions, what we can do. So dealing with difficult emotions can be challenging, but there are several strategies and tips that we can use effectively in our lives. For example, recognize and label your emotions. For example, begin with identifying and acknowledging what you are feeling. Give the emotion a name, such as anger, sadness, anxiety, or frustration. So this step is crucial because it helps you gain clarity about what you are experiencing. And like Rania was saying, that practice mindfulness. Mindfulness involves being fully present in the moment without judgment. Engage in mindfulness techniques like deep breathing, meditation, or yoga to help you stay grounded and observe your emotions without reacting impulsively civilly. And express your emotions. Find healthy ways to express your emotions. Talk to a trusted friend, family member, or therapist about what you are going through. Writing, so avoid self criticism is important. We have to reinforce individuals, avoid self criticism. Be kind and compassionate to yourself. And avoid self criticism or judgment for feeling a certain way. Remember that emotions are a natural part of being human. And practice self care. Take care of your physical and emotional well being. Get enough sleep, eat nutritious foods, exercise regularly, and engage in activities, and set boundaries. If your emotions are a result of someone else's actions or behavior, consider setting boundaries to protect your emotional health. Communicate your boundaries assertively and respectfully, and seek professional help if you find it challenging to manage difficult emotions on your own. So consider seeking support from a therapist, occupational therapist, or a psychiatrist, or a neurologist, or counselor. They can provide guidance and strategies tailored to your specific situation. And lots of therapies, like cognitive behavior therapy is a technique. Cognitive behavior therapy technique can help you challenge and reframe negative thoughts, patterns, and contribute to difficult emotions. So this approach can be useful for managing anxiety and depression. So practice relaxation techniques, like engage in relaxation techniques such as progressive muscle relaxation, or guided imaginary or deep breathing exercise to reduce stress and depression. Engage in creative outlets. Creative activities like art, music, sports, swimming, writing, reading can be excellent outlets for processing and expressing emotions. They allow you to channel your feelings into constructive form of self-expression. And focus on problem solving. If your difficult emotions are related to specific problems or challenges, so work on finding practical solutions. Give yourself time and connect with supportive communities, or the you know and sometimes people don't know I'm struggling with mental health or not. So how can I get help if I'm struggling with the mental health? Talk to someone you trust. Share your feelings with a trusted friend or family member or the expert, and consult a mental health professional firstly. If you are experiencing persistence or severe symptoms, you consider seeking help from a mental health professional, like therapist or the counselor or the psychiatrist or the psychologist. And seek support groups. And you also can use nowadays, you use on utilize online resources, and reach out to your primary care physician, or consider emergency assistance. And self care is important, and follow your treatment and the guidance given by the counselors. And therapists and counselor play vital roles, because some, for example, many people have bipolar disorder. So some people have bipolar disorder, so they have to go to the psychiatrist or the therapist or the medication management, because medication management is also required for such problems. For example, sometimes social anxiety is there. For example, social anxiety is there. So therapist or counselor will help them. Look for a therapist who specializes in anxiety disorders, particularly social anxiety. They can employ techniques like exposure therapy or cognitive restructuring. and group therapy. So lots of things, and they will also help you with mindfulness and relaxation techniques. For example, some students have, some individuals have ADHD, attention deficit hyperactive disorder. So psychiatrists or psychologists will help them, medication management will help them, behavioral interventions we can do. Sometimes people are struggling with OCD, obsessive compulsive disorder. So therapist, seek a therapist who is expert in the treating OCD. So medical evaluation will be there, or the support groups will help them. So lots of lots of things are there. And you know uh, like Rania was saying really well, that medication, lifestyle changes, and therapies, because lifestyle also play vital role, because regular physical activities and balanced diet, or the proper sleep, and support group is also important in our life. Professional help is also there. So you know light therapy, or you can say support from loved one is also essential. Encourage family and friends to learn about depression and its challenges, so they can provide meaningful support. So these all things we can do. For example, emergency, sometimes in the emergency, develop a safety plan for times when depressive thoughts become overwhelming, including a list of emergency contacts and crisis helplines. So I should know some numbers, share this, we can share my feelings to others in my difficult time. So education and awareness and sensitization is also important, because as a teacher or as an educator, it's our duty to sensitize the society. Education and awareness is important. So lots of things we can do. Yeah, as Rania also mentioned there, and like Solomon also. So I was listening both of you.
Yes. Perfect, perfect.
Thank you.
Wonderful analysis, and we know very well that mental health and depression knows no barriers. Anyone, regardless of income, education, race, gender, success,
Yeah,
or beauty, can get
you're
depressed.
right.
And something else that we need to highlight is that researchers estimate that between one third and two-thirds of the cause of depression can be traced to our genes. I mean that depression is related to our brain chemistry.
Yeah,
Differences in our
yeah,
levels of serotonin, norepinephrine, and other chemicals may make us more prone to be depressed. And
yeah,
of course, there are many factors that we haven't mentioned. They're bringing, of course, family issues that makes us more vulnerable to depression. So thank you very much. And if we talk generally about mental illness or mental health disorders, is all this huge range of conditions that can impact someone's behaviors, moods, and thoughts. Some mental disorders may be temporary and mild, while others can be chronic and severe and may lead to this
yeah.
way to mental health
Right.
problems. Um, for some people, it's not something that mental illness is not something that they have to work to maintain, but for some people, it can be a lifelong challenge that requires constant effort and attention.
Yeah,
And this mental illness can negatively impact an individual's life, as well as the life of those with whom he or she interacts. That could be the difficulty in making daily tasks, relationships, normal functioning difficult or even impossible. So I would like to ask Mr. Solomon, what are the warning signs of mental illness? What are the early signs of mental illness that are actually obvious?
Okay. Thank you
Mr.
so much.
Solomon? Yes.
As yeah, I think you hear me. Yeah. Thank you. As we mental illness is definitely, I will say, it's it's sad. It's one way, but it's the main fact that is a worsening scenario of the brain when you have a high peer, a impaired functioning of the brain. So in the sense that this is called by severe mild diseases of the mind, brain chemistry, on how one will react to that. As the speaker spoke the last time here, about different kind of disorders. These are all different kind of diseases, different type of mental illnesses, anxiety, depression, all other bipolar, OCD. These are all different kind of mental illnesses. So it is important that we start recognizing when it's becoming an illness and when it's passing from the mental health status to an illness because of when when your brain chemistry is being influenced or you are like your environmental factors affected individual, so they know more, they became more persistent with certain behavior, uh, such as productive activity, anything that make a meaningful to life, anything that, sorry, uh, sorry, yeah, anything that kind of bring the brain impairment functioning. Sorry, I'm having my phone misbehaving. Yeah, anything that is actually misbehaving the brain, sorry, anything that is affecting the body to misbehave in certain manner that is not responding on a more positive way. So in the sense, this can should be diagnosed by psychiatrists and it will be identified as a certain specific disorder. But in aspect where like any normal person, you were a functional person. You are going every day to do your daily chores, and then all of a sudden everything starts changing. You start showing different kind of behavioral changes with people around you to an extent that it is affecting you as a person. It's affecting your productivity. It's affecting your environment without not realizing it. Even when it comes to hygienic consciousness, they easily forgot that they will have to. You can easily forgot that today I have to clean my hand. I need to take shower. All these things are certain things that a layman can pay attention to when these things start changes. It means that uh, uh, you are facing the signs and symptoms of mental illnesses, and it is important you seek for professional help so that they can diagnose what kind of disorder you are suffering from. So, in order for you to get certain specific help. So, it's important that when the illness out there, when the illness affecting one, it is important for one to start um, being engaged in a more productive manner. That either through therapeutic format or through medical format, when the psychiatric is treating the individual, it's good that they are engaged in productive activities in order for them to reboost the way they think, the way they relate to others, the way they start being productive again. So somewhere, somehow, if you can please reconnect me back to the question exactly, somewhere I think I'm lost. Let's get distracted along. Yeah.
Definitely. And when we see some personality change, sometimes you say it's hard to feel like yourself, but when this feeling persists, of course, you will need to seek help and look for underlying problems. When you see emotional changes, uncharacteristic anger, anxiety, irritability, when also you feel isolated constantly, or you stop self-caring, or you have a feelings of hopelessness, of overwhelmingness, um, sleeping problems, constant feelings of depression, feeling disconnected from reality, problems concentrating, changes in weight or appetite, poor personal hygiene. All these are things or warning signs of mental health issues. Thank you very much for your brilliant analysis. And I would like now to call upon Mr. Mohammed Zubair to share with us what are his suggestions, what are the strategies that we can use in order to maintain a good mental health.
Yeah, sure. You know, as I was listening, both of you, great speakers, and you both were mentioning about the mental health and the depression and the mental illnesses. So, as we all know, as Rania mentioned, because lots of challenges are there, like persistent sadness or low mood, feeling sad, and the hopeless, or the experiencing a low mood, changes in sleep patterns, and like hypersomnia or the insomnia, or changes in appetite, like Rania was saying, in weight, or the interest, or low energy, difficulty in concentrating, and gastric problems, or the irritability, hallucinations, and physical symptoms, lots of physical symptoms like headache or digestive problem, or the ache or the pain, and delusions, mood swings, you know so lots of challenges are there. So but it is important how we can deal with them, because for example, if someone is if someone is in depression, for example, persistent sadness, loss of interest in activities he or she has, or his or her appetite, or she has lost her appetite. So what we can do, for example, treatment maybe include psychotherapy, cognitive behavior therapy, medication, lots of, if the condition is severe, antidepressants, lifestyle we have to change, and support from friends and family. For example, anxiety disorder, for panic disorders. So what we can do, we can use psychotherapy, counseling, cognitive behavior therapy, medication, and anti-anxiety medicines, relaxation techniques, exposure therapy. Like the Solomon was saying, bipolar disorder is there, cycles of extreme mood swings, including manic episodes and depressive episodes. So what we can do, we can do mood stabilizing medications, psychotherapy, and lifestyle management is important, because lifestyle management play vital role in our life. But before that, clinical assessment is required. We have to diagnose the level of the problem. A mental health professional conducts a comprehensive clinical assessment and diagnose. This typically involves a detailed you know assessment of the individual on the basis of its symptoms, or the history, or the family history, like uh, I was saying that, like Rania told, uh, lots of reasons behind it. Family history is there. For example, many people have family history. Individual with a family history of depression are more likely to develop the condition themselves, like like heredity, genetical conditions are there, genetic variations are there, and neurotransmitter functioning is disturbed, hormonal regulation is not there, and sometimes brain structure and functioning is not good, the processing is not good, abnormalities in the brain structure and functions have been observed in the individuals with depression. And epigenetic changes, which can be influenced both genetic and environmental factors, and lots of environmental factors as well, like stress and early life experiences, or the social environment, or the job pressure, career pressure, peer partner pressure, fear, hesitation, lifestyle factors, or the physical environment problems, traumas, and the work condition is not good. So how can we manage? Management is important. Intervention, we how can we support? So psychotherapy is talk therapy. So CBT is important. CBT, cognitive behavioral therapy, helps individuals identify and change negative thoughts, patterns, and behavior, and it teaches coping skills and problem solving techniques. And secondly, interpersonal therapy, IPT, focus on improving interpersonal relationship and communication skills. Secondly, secondly, lifestyle changes. For example, regular exercise we have to include. Engage in physical activity can boost mood and reduce symptoms, and we can divert our brain. So healthy diet, balanced diet, rich in nutrients, including omega 3 fatty acids, or the vitamin D, or the vitamin B12, support overall well-being. Sleep hygiene is important, like Rania was saying, that establish a consistent sleep schedule and create a relaxing bedtime routine to improve sleep quality. And stress management, learn stress management techniques such as mindfulness, deep breathing, and progressive muscle relaxation. Secondly, we have to make a good environment at workplace or in the home. So support system is important. Maintain a healthy, positive, joyful environment in our families, in at our workplace, and seek support from loved ones. And consider joining support groups from individual with depression. And we have to teach them self-care strategies as well. Practice relaxation techniques, mindfulness, challenge negative thoughts, and practice positive self-talk, and set achievable goals and break them down into smaller steps. And some other things we can do is ketamine therapy, for example. So ketamine administered in a controlled medical setting has shown promise in treating treatment resistance depression. So another thing is, if the person is very severe, so antidepressant doctor or the psychiatrist will prescribe them antidepressant medication, and other can be prescribed for moderate to severe depression. So these medications work by balancing neurotransmitter in the brain, and the choice of medication depend on the individual needs and symptoms and potential and side effects. So medication management should be closely monitored by the healthcare provider like doctor or the psychiatrist or the neurologist. So sometimes hospitalization is also there. In cases of severe depression with societal thoughts or behavior, so psychiatrist hospitalization may be necessary to ensure safety. And counselors play vital role. Parents, counselors, so multidisciplinary team will support them. Uh, and professional help always required in dealing with them. And we have to the problem life the important aspect is that social aspect. Lots of people are not interacting with their families, not they are not very social in the society. So socialization is important. Talk to trusted individuals. Sharing your feelings with close friends or family members can provide you emotional support. And a social socialization will be taken place, and opening up of someone you trust can be the first step in seeking help. Then professional help is important. Yeah, thank you.
Definitely, definitely. Thank you so much, Dr. Mohammed Zubair and Mr. Solomon. Throughout the session, we had the chance to analyze depression first. Depression is not just one or two symptoms, it's a
Yeah,
constellation of different thoughts, feelings, behaviors, experiences. It's what we said, the feelings of hopelessness, of guilt, difficulty concentrating or making decisions, low energy. You mentioned insomnia or hyperinsomnia, loss of appetite, feelings of agitation. We talked about the different kinds of depression. There are lots of ways to be depressed. You can have a major depressive disorder, or you can have a period of milder depression that lasts for about 2 years, which we call systemic disorder. You can also have systemic disorder and a period of major depression concurrently. So this is the diagnosis of double depression. We have many women who suffer from what we call postpartum depression after the birth of a child. And other important diagnosis to keep in mind is what Dr. Joubert said about bipolar disorder. Of course, all these mental health issues are very costly on many levels because they can lead to high rates of absenteeism from work, lower productivity, high rates of disability. Depressed people are more likely to have unhealthy lifestyles that include things like smoking, inactivity, poor diet. These people say that I eat ice cream and cookies to try to feel better. And then afterwards, they say that they feel awful because they know that they have lost control. For some other people with depression, for example, this unhealthy lifestyle leads to greater risk of cardiovascular disease. And depression also places at a greater risk of developing Alzheimer's disease and stroke. You talked also, or gets presented as strategies like cognitive behavioral therapy, psychotherapy, problem-solving techniques, how it is important to practice a balanced diet, good sleeping patterns, the change of automatic thought distortions that I mentioned at the beginning, like overgeneralization. And in any case, first we need to focus on the necessity to self-care, to care ourselves. This is the priority. So thank you very much for your contribution today, for your valuable presence and your valuable input. Thank you very much, Mr. Solomon, Mr. Muhammad Zubair. I would like to thank also our audience who watched us live. So see you again in the next session. Thank you very much for watching us. Thank you.
Thank you all of you, and thank you the organizers for inviting me. Thank you all of you. Thanks, Rania.
Yes, especially
Take care.
Dr. Jude and Vivian. Thank you very much. Thank you.
Yeah, thank you, Rania. Take care. You can leave now. Okay, bye bye.